Bangalore. We have with us our expert Dr. Sushma Rani Raju, a senior consultant nephrology, to discuss all your queries on organ donation, save a life after life. Good afternoon, ma'am. Welcome to our live program. Ma'am, here are a few questions from our viewers on organ donation, ma'am. Let's start, ma'am. What is organ transplantation? Which organs can be transplanted?
Organ transplantation means removing an organ from a donor and transplanting it, placing it in another individual whose organs have failed. Okay, so the person from whom the organ is removed is called as a donor. The person in whom this organ is placed is called as a recipient. Commonly the organ transplantations are done for say kidney transplanted in a kidney failure. If there is a heart failure, then the heart transplantation happens. Okay, and the livers can be transplanted, pancreas, small intestines, then lungs can be transplanted. So these are the various organs which can be transplanted.
Okay, ma'am. Okay. My next question is who can become an organ or tissue donor?
So organ and a tissue donation. So if the organs can also be donated, like I said, your heart, lungs, kidneys, liver, and the tissues can also be donated. Tissues in the sense that the cornea can be donated, the media parts can be transplanted. Okay. Similarly, the bone marrow, connective tissues, blood vessels, nerves, these things can be transplanted. This is called as a tissue transplantation. So who can be a donor? Anybody, irrespective of age, sex, okay, if they fit into the criteria of a donation, if they are healthy, so anybody can donate organs or tissues.
Okay, okay. Which organs and tissue can be donated after death?
So again, when we speak about a donation, right, there is somebody who is a living individual who can donate few organs and tissues, and then we have a person who is brain dead, declared brain dead. They can also donate. Here, your question is at brain death.
Okay.
Who are the people who can donate
Yes,
and what
ma'am.
organs, right? So the kidneys, pancreas, lungs, heart, small intestine. Okay, these are the few organs which can be donated when somebody is declared brain dead.
Okay.
Because, for example, the lungs and the heart, obviously, a living individual cannot donate, right?
Yes,
Okay,
ma'am.
yeah, that is required for the survival.
Okay,
Yes,
okay.
the brain death individual, since there is no more life in them, then
Do I have to register as an organ or tissue donor with any hospital or national registry?
yes, very much. You will have to register with either your state level or a national level organization. There is an organization. Okay, so in Karnataka we have a SOTO, that is a state level organ tissue transplantation organization. Either that or that is also called as a Jiva Sarthakate, the NGO. Okay, that can be done with them, or you have a national level organization. Same thing in India, we have NOTO, the National Level Organ and Tissue Transplantation Organization. So in India, you can register with any one of these, and sometimes your various clubs, okay, and the companies, they make a a campaign wherein they collect the names. You can pledge for an organ donation, and finally they submit this list to either the SOTO or NOTO. These are the various ways that can.
Okay. My next question is does organ and tissue donation after death cause any disfigurement to the donor?
No, this is a myth actually. Whenever the organs are retrieved, right, it will be done by a trained and a qualified surgeons. So it will not cause a disfigurement.
Okay, okay. Do I have to pay to be an organ and tissue donor after death?
Definitely no. There is no whatever the financial burden to the donor's family. The only thing that the donor family, after death, if somebody donates, that they'll have to take care of is the final rites, the funeral rites, whatever the expenses that. Absolutely, there is no fees which is has to be paid by the donor family.
Okay, okay. How are organs from deceased donors distributed?
Okay, so say if somebody pledges today to become that organ donation, okay, and once somebody is declared brain dead, the family, if you have expressed your wish to donate an organ, the family, friends, they come forward, they express, they carry your wishes to the, convey the wishes to the hospital authorities, wherever at the last breath of our life we are admitted. So these people will inform that to the state level organization committee. That is in Karnataka, we have something called as a Jeevasarthakate or a SOTO. Okay, the people, officials from there, they will come over here. They will talk to the relatives of the proposed donor. They will take an informed consent, and once it is consented, yes, the process of organ harvest happens. Organ harvest happens, then there will be a registry of recipients who are already in the wait list. Okay, they match, they look, there are various allocation criteria. They look into the criteria, and as per the criteria, they allocate these organs to the suitable recipients.
Okay. Okay. How is it determined if one is eligible for organ transplant?
Okay, this is for the recipient. Okay, if somebody wants to get a transplantation done for whatever the reason that they have, first consult your doctor. Okay, then if they have a facility for transplantation in their hospital, they will take it forward, or then you will have to go, they will refer you to a place where the organ transplantation is happening. So once you go there, they will do a baseline medical checkup. They assess whether one is fit for a transplantation, and once they deem that the person is suitable for the organ transplantation, then their name is waitlisted in this waiting list.
Okay.
Okay, and the master waiting list, which will be there with the state level organization or with the national level organization.
Okay.
Okay, so you will have to fulfill this criteria. A, there is one criteria which fulfills the hospital where you are registering, and then at the national level, state level, wherever your name goes.
Okay. Does old age affect in determining organ transplant eligibility?
No, definitely no. A couple of years back, yes, the age of 65 was put as a cutoff by the government, but nowadays they have taken it out by the recent amendments. So anybody, irrespective of the age, if they are in an organ failure, they can actually be on a wait list. Age is not a criteria.
Okay, ma'am. My last question is, how does the matching process work for organ transplant?
So matching process happens at three levels. Okay, one is blood group matching. Okay, the blood group should be compatible, and then there is something called as a tissue matching or a cross match.
Okay.
Okay, the tissue, the donor's antigens
Okay.
should match the recipient's antigens. Okay, that is the second. And the third thing is a HLA typing. That is, which determines the genetic basis, how they are genetically matched. So genetic matching, tissue matching, as well as your blood group matching are important.
Okay. Okay. So, anything would you like to tell anything, ma'am?
I say yes, organ donation is a very important act. Okay, you will be able to live even after you die, and you will be able to save someone's lives. So please do that. Every day, almost about more than 3 lakh people are dying because of lack of transplant.
Correct.
Or because of organ failure, be it heart, kidney, liver, whatever. Okay, and in them, hardly 3.2% or so will receive the transplantation. So please don't take your organs along with you during your death. So please donate and give a life, give them a second chance.
Sure, ma'am. We can save someone's life also.
Yeah.
Thank you, ma'am. So with this, we come to an end of today's live show. So thank you, ma'am, for your valuable insights. Thank you, viewers, for joining us. If you have any queries, you can leave a comment and our expert will answer them for you. Thank you, ma'am.